Not everybody is ready for surgery, so there is an alternative solution. That is injectables. Whether it's derma fillers or a neurotoxin, there is a solution. Here at Concierge, you've probably sat in a chair very similar to this and have met one of our outstanding, exceptionally trained and skilled injectors. In each one of our 5 locations, from the city to Geneva, you can rest assured that you will be receiving excellent advice for full facial balancing. Now let me introduce Eric. He is our Assistant Medical Director, and see what he has to say about facial rejuvenation.
My name is Eric Doms. I'm a board-certified physician assistant and associate medical director here at Concierge Aesthetics and Plastic Surgery. Today I'm here with one of our patients, Sheila. She's interested in full facial rejuvenation and had undergone a procedure with us several weeks ago. She's also a past surgery patient for us as well. So when Sheila came to me, she was interested in maybe some fine-tuning of just basically top-down, full-face rejuvenation. So Sheila, why don't you tell us a little bit about what made you interested in kind of doing full-face rejuvenation?
I wanted to have a facelift, but I didn't want to have the downtime, and I did not have the time. I work, and I needed to make sure that I looked good quickly. And it was the beginning of the summer, and I wanted everything, all the effects that a facelift would give. But I came to you, didn't think that it was possible, and we had a consultation, and lo and behold, everything that you did is exactly what I was looking for. Now here I am a few weeks later, and I get compliments all the time.
Oh, that's fantastic. We do have a lot of minimally invasive options that are available to rejuvenate not just the cheeks and the jawline, but also areas like the brow, the temples, lips, and even underneath the eyes.
And the other thing that I think was so important for me is our neck also gives us some aging, and I wasn't prepared for the difference that your injectables made on my neck, because my neck to me looks 20 years younger as well. And that was an extra added surprise that came with it.
Absolutely. Yeah, I think the neck can often be like the final touch, the icing on the cake, if you will, for a full face. You don't want to forget the neck because it just helps tie everything together and gives that nice appearance of a rejuvenated look.
Absolutely.
So we're going to go into a little bit of detail about what we did for Sheila and her full face rejuvenation. I think when it comes to any sort of full face rejuvenation for all patients, it's important to take a top-down approach, remembering that any correction that you provide to an above area, it will have some correction to the area below it. So when we're looking at Sheila here, what she was desiring was a little bit of filling of her temporal hollowing here, as well as a little bit of a lift to her lateral brow. So what we did is we used a product called Radiesse and injected it along the aspect of her temples bilaterally, as well as a small amount into her lateral tail of her brow. What this did is it allowed for a small lift of the area, giving more opening of the eye and more support to her brow, keeping this nice arch that she has and giving it a slight enhancement. Filling of the temple can also provide an improvement in the overall shape of the face, giving somebody a nice oval shape to the top half of their face as opposed to maybe an indentation, which can often be an early sign of aging and a dead giveaway. Following correction of the upper half of her face, we moved down to her mid-face. So for her mid-face, she desired a little bit of a lift to her cheeks. So we added some product to her lateral zygoma over here, as well as a small amount to her anterior medial cheek, so that we could maintain her nice cheek projection, as well as provide some lift to her cheek as well. This improved her nasolabial folds, which were then filled with a small amount of product to just provide some improvement in the shadowing of that area as well. Following correction bilaterally of her cheeks, we moved down to her jawline. The jawline was improved using, again, Radiesse to provide improvement in the shadowing along her lateral jawline, so providing some improvement to her gonial angle as well as some of her prejowl sulcus here. By doing so, we have a nice shadow and definition along her lateral jawline here, as well as adding some of the product to her marionette region and chin, giving her a nice projection of her chin as well. We did this on both sides. Following her jawline, we moved down to her neck. For her neck, we used a combination of hyaluronic acid and Radiesse. By hyperdiluting the Radiesse, we allow the product to be more of a collagen stimulator, boosting skin and providing a tightening effect, as well as adding some of the hydration effect of the hyaluronic acid, giving a nice smooth contour to the neck and further pulling of that neck and tightening effect. Here at Concierge Aesthetics and Plastic Surgery, we offer a wide array of injectable treatments. These injectable treatments can provide dramatic and amazing results with minimal downtime to patients. Patients who are looking for mild to moderate facial improvement and reduction in wrinkles can expect improvement of these areas following injectable treatment. If you are interested in minimally invasive, non-surgical, anti-aging treatments such as injectables, I recommend you schedule a consultation with one of our expert injectors to develop a treatment plan that's right for you.